Good afternoon, families, and welcome to our Health and Wellness Family Friday. My name is Lydia Suit, and I'm a graduate intern with Parent and Family Programs. I'm really excited to be joined by several representatives from Health and Wellness. So we have representatives from Campus Recreation, Health Promotion, the Student Health Center, and the Counseling Center. As with our other Family Fridays, we'll start with a 20 to 25-minute presentation, and then we'll have plenty of time for question and answer. For Q&A, feel free to submit your questions using the Q&A feature at the bottom of your Zoom chat. At the end, I'll be moderating questions, and we'll get through as many as we can. So to kick things off, I'm going to hand things over to the Integrative Wellness Manager, Lindsay Heck.
Lydia, thanks so much. And thanks to all of the William and Mary new families and returning families. We're so thankful to be here with you to talk about health and wellness and share all the resources that we have available to you. I'm Lindsay Heck, and I'm the Integrative Wellness Manager. I'm here with some of my wonderful colleagues that I'm so fortunate to work with in health and wellness, and they represent almost all of the departments of health and wellness, but it's just a handful of the folks who are here on campus to support the well-being of your students while they navigate their time through William and Mary. Here on campus, just to give you a little bit of background about our approach, we have an integrative approach that provides access for students to connect with a variety of disciplines and professionals from our departments, which are health promotion, campus recreation, the counseling center, the student health center. And this design really allows our students multiple avenues of entry to connect with resources that meet their health needs or their health wants. The services and programs that are available span the full spectrum from education, prevention, and also treatment options when intervention becomes needed. So whether they're sick, they're well, they want to learn about the harmony of wellness, we're truly here to help them learn what wellness looks like for them with that full respect that that's something that's unique for each individual. In health and wellness, we absolutely challenge the traditional stress glorification culture that sometimes exists on campus. And we definitely understand and value helping students to develop those skill sets that help them cope effectively with stress. We know that this will be a part of their journey at William and Mary. And this really drives us to have a focus on prevention-based programs. And that's an important factor in assisting students before they reach any level of crisis. Our campus is very fortunate to have not one, but two facilities that are dedicated to health and wellness. We have the B. McLeod Recreation Center and also the McLeod-Tyler Wellness Center, where I am housed right now. The easiest way for everyone to connect with all the programs, the services, and the resources that are available is absolutely through the William and Mary Wellness app. You're going to hear a lot from our other folks who are on today about the services and resources that you have available. I know it's a lot of information, but I definitely encourage you to download the app. It's just the quickest access to connect with the counseling center, the health center, and it's also a registration portal for all of our programs that range from body pump classes, meditation, and art therapy here at the Wellness Center, and also outdoor adventures and things that are happening out of the rec. So I definitely recommend connecting with that to get connected with all of our folks. If you have the William and Mary app already, you can also access it through the health and wellness section that's available there. And I know each of us only have about 5 minutes to share all of the things that are available within our departments. And so if you have any questions, please feel free to email us at wellness@wm.edu, and we'll definitely get your question connected to the best resources that fits your need. I'm also going to be sharing with you in the chat here shortly the Parent and Family Launchpad. And that's going to include for you some quick links to get connected to the departments and get any more information about the resources that we chat about here today. So you can find that there as well. And I'm going to go ahead and start with the early part of our spectrum, the education and prevention piece. I'm going to hand it over to Hannah from our Office of Health Promotion.
Hi, folks. Good to be with you today. I am in the Office of Health Promotion. I am one of 3 assistant directors who think about how we can establish systems and interventions and support for students from the moment you're thinking about William and Mary to graduation and beyond, around various wellness topics. So a lot of our topics that we focus on will overlap with our intervention areas. So we look at mental health, we look at sexual violence prevention, alcohol use, nutrition, sleep habits, stress management, you name it. If it impacts wellness, we are excited to work with students on addressing those issues. So our Office of Health Promotion works off of the socioecological model of intervention. We look at how we can support students individually, how we shape relationships, the community, and then the larger institution as a whole. So we're looking at prevention from all of those different areas. The way we do so with one-on-one health coaching, we can support students individually and what their needs are. We also have an interesting program called SOS, which stands for Self-Care Over Soothing, which provides students an opportunity to go online, take an inventory, and then look at alternative interventions for what self-care might look like and what support they might need to get on a better track or to address some wellness concern that they might have. Some things that are offered through that program is health coaching or yoga therapy, art therapy, mindfulness. So lots of very original and creative ways to connect with students outside of the kind of typical self-care things we talk about. So that's an option for all students. On a more relationship and community level, we train all of our peer educators, our residence assistants, our orientation aides. Everybody gets prevention education from us. In addition to those groups, often fraternity and sorority life or a registered student organization will reach out to us to work on content together, sometimes to address wellness issues they see specific to their community. And we have wonderful peer educators that are certified to train their peers on lots of different wellness topics. And so if your student is interested in getting involved in helping others be their best selves and have a great experience at William and Mary, have them check out. We have Hope, which is our health outreach peer educators. Someone You Know is our student group that educates folks on sexual violence prevention. And there's other ways to get involved with our office that are not just peer education. So connect with us if that's something you're interested in. Lastly, my biggest plug today, my most important plug, is the piece of prevention we do for the community, the university-wide prevention. And that is what your new student will be asked to do, is 2 courses on sexual assault prevention and alcohol. These courses, one is about half hour, one is about an hour long. We just got up and running this morning, so your student will receive an email soon if they haven't already with their login and how to reach the course. These courses help us establish a baseline of information and expectations for every incoming student. But additionally, it can be really beneficial because you can ask your student, if you haven't had a conversation with your student yet about what their relationship with alcohol is going to be like when they come to college, or what their understanding about sexual violence is and what consent is and what resources are available at William and Mary. It's a great time to ask. And if it's hard to have that conversation or hard to bring it up, you can use this course and you can say, well, what did you think about that course? What stood out to you? How did it go? And you can blame our office for sort of initiating the challenging conversation. And then I hope that you will follow up with them because we know that you're their most valuable resource. So if there's further questions about the prevention program, happy to connect over that email, wellness@wm.edu. Lindsay will get those to me, but also in the tribe guide, there is specific information linked in what Lindsay will share later that gives more details about the course, why we do it, the content that is covered, etc. So I just ask you to touch base with your student about their experience going through that course and help them get it done. It's officially due September 5. And later in the semester, if it's not completed, they'll receive a hold on their account, which will impact spring registration. So we want to hopefully get it done in the next month so that they don't have to think about it when they're here on campus. That's all I got. Thanks, Lindsay.
Okay, I think I am up next. I am Linda Knight, and I serve as Executive Director of Health and Wellness and Director of Campus Recreation. And I know we only have 5 minutes, so I'm going to go through this pretty quickly because we have a lot of programs, but like everyone else, happy to answer any questions you might have beyond what I share with you. I am very fortunate that I'm kind of on that prevention side also with Hannah. I think all of our areas would love to be on the prevention side. We just are fortunate enough to be able to have more access to that because we don't have to work in the reactive mode like our health center or our counseling center sometimes has to do. We're very fortunate that we can try to keep people out of their offices a little bit. But also just wanted to tell you a little bit about the programs we have. We are very fortunate that we have over 80% of the students participate in some form of campus recreation. And that's not, I mean, we do provide great programs, but that's also because the students want to be active and they want to take care of themselves. And that's a big push of our wellness. As Lindsay said, we have basically 2 wellness centers, but you'll also hear over and over, and your students will hear over and over, wellness is everywhere. So it may be they can find wellness walking to class, they can find wellness in their classrooms, they can find out wellness in their residence halls. So it's not just the 2 buildings where they get that. We hope to teach them how to be well, and then they can take that level and do it wherever they might be. But through our program, we offer intramurals, which is basically activities, mostly sports within the university. So one residence hall will play another residence hall, or a student group will play another student group. It's very easy to sign up. They just sign up and they're on a team and they come play for us. And that's a fun thing that we do all year long. We also have sport clubs, of which we have 45, which is the largest sport club program in the state of Virginia. And those clubs, for the most part, can play other schools. So our sport club might go and play University of Maryland, or might go play UVA. So it's still sport related, but they are participated against other institutions, which is, I tend to call it my mini varsity program without coaches. Some have coaches, some don't, but it is student run, and that's really important to us from the student development piece, that they get that opportunity. We have what we call the Tribe Adventure Program, or you might hear it called TAP. And that is where our outdoor programs go to different places. They go skydiving, they go hiking, they go canoeing, kayaking, skiing, any program you can think of, we pretty much offer it. We usually do 2 to 3 programs a weekend. I would tell you about the Pathways program, because that is the pre-orientation outdoors trips. Unfortunately, right now we're already full. So those filled up pretty quickly, and the students that have already signed up have filled that up. But if your student's still interested, have them get on the waiting list, because we do have cancellation sometimes. And they would be happy to put your child in there. That'd be great. Our rec center has a pool, so we have aquatics in that area. We certify people in CPR and first aid. We certify about 300 people a year, and that's mostly our student workers. So again, if you want your son and daughter to work, we hire about 300 students a year in different areas, from working at the front desk to teaching fitness and wellness classes to being a lifeguard. So there's all types of opportunities for students to be employed by Campus Recreation. And the last program we have, I don't mean to save it for last, but is our fitness and wellness program. And that we offer about 60 classes a week in that area. And students, the reason I saved that for last is because you heard us talk about the McLeod-Tyler Wellness Center, and then you heard us talk about the B. McLeod Recreation Center. So those names, McLeod and Tyler, you'll hear a lot, but one of the latest gifts, and probably one that I find is wonderful as anything, is they gave a major gift that allows us to offer all the fitness and wellness group classes free for students forever. So if your student is interested in taking a fitness or wellness class, that will be free for them. They have to sign up just so we can keep records and they make sure we don't have too many people in a class, but their class will actually be free and they can take as many as they want every week. The things they can't get free are some of our services like massage therapy or personal training, because what we have to pay those instructors doesn't get covered through this gift. But any of the group classes will be free for students. And that's a pretty nice perk. We knew that was a barrier. And when they made those classes free for us, we were able to triple our numbers in that area, which was wonderful. But so that's basically the areas that we cover. We do have 2 athletic trainers that are on our staff now that mostly work with sport clubs or people that might get injured in one of our programs. It's not necessarily open for, students out running, they roll their ankle, that we can see them and help them get to where they need to go, but they wouldn't be able to necessarily sign up for regular appointments with the trainers because of the numbers of the students that we already see through the programs. So that's just a little bit about what we do. The last thing I would say is that what is really unique here and what is different here that I love the most and why I've stayed here for 21 plus years is the way that we all of us in health and wellness work together. And if I need something, I can very easily reach out to the counseling center, or I can reach out to health promotion, or I can reach out to the health center and say, hey, I've got a student I'm worried about, or we got a program and I'd really love you to come talk to some of our students about some things. And they don't hesitate. The answer is yes, we'll do it, because we're all in this together. And we know that students enter the wellness portal from very, very different places. And so our goal is to allow us to all have a place that we can reach that, and we all contribute to that. So I need to stop now because I know we need to move on so the next person can get on there. And I think it's my turn to introduce Karina, who is the director of our counseling center.
Thank you, Linda, and thank you everyone for being here. As Linda mentioned, my name is Karina Sudarsky-Glazer. I'm the director of the counseling center, have been at William and Mary for about 25 years, I think now. So I had, as Linda said, I have stayed here a lot because of the collaboration across our different areas of expertise, as well as, the students that are amazing, and we are very lucky to work with them. So at the counseling center, we offer services of different type approaches, and I will talk about them. But I want to make clear that students could seek services for issues that they had worked on in the past, as well as new issues that they are experiencing as they come to campus and experience the new life as a college student. The main 3 areas of concern that our students tend to express, number 1 is anxiety, number 2 is depression, and the third presenting concern in frequency is relationship issues. It's interesting that it used to be number 1 depression and number 2 anxiety, but this has changed across different universities. Actually are seeing as anxiety as number 1. And that's I would like to invite you to think about why that may be the case. So the way to enter the counseling center, there are different options, but the most common is asking for a triage. A triage appointment is where we would get a sense of what the student needs. And from there, we make decisions with them about the best treatment approach. So we certainly provide services to all students, but we are not a comprehensive mental health facility. So when a student needs more specialized services or a frequency We offer services every other week for individual therapy, weekly for group therapy. So if someone needs individual therapy weekly and for a long-term, on a long-term basis, we have a mental health services coordinator that would help refer out the student, and they would be then in need to use their health insurance to cover their copays. They would need to pay their copays, but the rest of the session would be covered by their insurance. Again, we help them find a therapist in the community when there is more need than what we are able to provide in terms of frequency or a long-term approach. I want to also share that our services are confidential. So students would need to sign a release of information if they need us to talk to the dean of students, if they need to involve parents, even if a parent calls and says, I know my student is seeing so-and-so, we are not able to provide information. This is based on our ethics as well as the law in Virginia and most other states. So again, some students are very willing to involve parents or let us share some information, but they would need to sign a release. As I said, most students would come through a triage appointment where we discuss the presenting concerns and decide on the disposition. A student can also come through a crisis appointment, and crisis appointments are based on the student perceived needs. So they would come in and say, I am in need for a same right to be seen right now, and we will see them that same day. At certain times of the semester, there could be a little wait for a triage appointment, and I want you to be aware of that. It's not much different for the way that would be in the community, though. After hours, we also have services for crisis. So a student can call just our same phone number, 221-3620, and get connected with a counselor on call. As I mentioned, we offer individual therapy, group therapy. We do have a psychiatrist. The psychiatrist tends to see students who have a significant psychiatric needs, mostly issues of bipolar disorder, complicated anxiety or depression when they need more than, say, one medication. Otherwise, for the most common anxiety, depression type of concerns, if they need the medication, we would refer to the health center where our physicians are very able to provide medication, prescribe, and follow up students for those type of issues. We do offer outreach services. So from a prevention side, if a group of students or an organization is interested in us presenting on a given topic, they would fill a form that we have online, request the type of speaker they want, and they would then be able to get one of us present on the topic of interest. And so I think I share most of what I wanted to share at this point. And I want to thank you for your attention, and I'm willing to answer any questions you may have. And I think next is Katrina from Health Center.
Katrina, you're on.
Sorry. Sorry. I'm Katrina. I'm Katrina Holden. I am a registered nurse and also the nurse manager down at the Student Health Center. We are located on the first floor of the Wellness Center, so I get to see all these talented individuals on a daily basis because we all share a building. And That's been since 2018, and I think it's been great getting to know each other better. Before, we were spread all over campus, so it's been really good getting to know everyone. And it does, and the collaboration, I think, is definitely just increased by having us all together. So we are the Student Health Center. I think, as they answered in the chat, we have 3 medical doctors, 3 nurse practitioners, and 6 registered nurses. We also have a pharmacist, a lab techs, and a referral specialist. We also have several administration staff and a medical records person. So we are here Monday through Friday. We see full-time students, and we are accredited through the Accreditation Association of Ambulatory Healthcare. So we just finished our accreditation survey, so we passed with flying colors, so we're good for another 3 years. And I think it's like less than 10% of health centers across the nation are accredited through it. So it's a pretty rigorous program, and but we successfully did it this past year. So like I said, we see full-time students. We offer a range of services. So I'm going to kind of read off of them so I don't miss anything. We do provide allergy injections, physicals, all types of vaccines, medical care of acute and chronic illnesses. We have the capability of administering IV fluids, IV antibiotics. We have offer men and women's specialized health, contraceptive services, STI testing. We do evaluate and treat for mental health disorders, orthopedic care, and we do act as an urgent care. So I think one of the questions was, do we have urgent care? So we kind of operate as a primary care as well as an urgent care. So we can manage chronic and acute diseases, and we have a lot of people that come with different health concerns, so we can manage those on a regular basis. But we also have people walk in that fell off their bike, that need stitches, that have, had a concussion, that started throwing up that morning. So we do have walk-ins. We do both. We have appointments, and we do have walk-ins. During coronavirus, during the pandemic, we did kind of have to back off and require appointments, but we've kind of laxed that up a little bit, and we do take walk-ins. So we do a little bit of both. After hours, we partnered with Healthiest You, which is offered through the student health insurance, and it's an after hours telemedicine. So over the weekends and after hours, it all through the night, they can do telemedicine appointments with nurse practitioners and medical doctors. That is open to non people who do not have the student health insurance. I think it's $55 for the visit. I don't think there's a fee if you have the student health insurance. But what I found has been great is that most private insurances offer that telehealth. They partnered with somebody, like I think Anthem partnered with something called Live Health. So if you have a student that's coming here, it's great, and you do not have the student health insurance, contact your private insurance and find out who they're partnering with. Often there's no copay. It's 24-hour care, and it just provides that after hours care if your student is not sure if they should go to the emergency room, if they can wait till morning and come see us. That's just a great resource. And my own kids, who are one's graduated from college, one's college age, they have used it after hours and the weekends, and there are actually quite a few conditions that are appropriate for that. So I definitely would say have them download that app and go ahead and put their information in, so after hours they have resources. But we also do have an urgent care that's about a mile down the road. And then the university has partnered with VCU Health. They provide mental health services, but they also provide a walk-in convenient clinic that's walking distance from campus as well as some specialists that are in the office that are in that building as well. So we do have quite a few options for after-hour care, and 2 good hospitals about 5 miles each away from campus. We also have, I said that we had a laboratory. So we do labs as needed by our own providers, but they do outside labs as well. So if you have a student here that needs regular labs, their doctor can send the order here just by contacting our lab. They can fax it to us, and they can have regular labs drawn here. So we call that a courtesy lab draw. And they do, although the student health insurance does not bill insurance for doctor visits, the lab and the pharmacy can bill your insurance for prescriptions or any outside labs that we need to send out. Like I said, we do have a pharmacist here. they can fill most prescriptions, as well as they sell over-the-counter stuff. So if your student needs to stock up on Advil or Tylenol or any of those things, or needs a thermometer or heating pad, our pharmacist carries those as well at very good prices. And they can also, you can transfer your prescription here. Your student would just need to come here if they have a prescription and it's more convenient to get it here. They just bring their prescription here, and our pharmacist can reach out to that, to your local pharmacy, and have it transferred here. And then they can transfer it back when they go home for the summer. Like I said, we do by appointment, but we do take walk-ins. And it's just as Karina said, all of our records are confidential. And our biggest challenge is that concerned parents call and want to find out what's going on with their students. So if they are over 18, please make sure that your student has signed a release of information, because unfortunately it's tough, but we cannot tell you if they're here and what has happened. And as a parent, that was one of the, that was a tough thing to get used to. But we do the release of information online, so your student can do it on their portal and have it release specific information or a general release that's good for a year. And I think that is about it. But I'm welcome to take questions. I'm sure that I've left something off. So feel free to ask any questions you have about our services here.
Awesome. Thank you all so much. That was very helpful to get an overview of each of your areas, and then also learn a little bit about the collaboration and integration between y'all. So we do have a number of questions in the chat. So I'll just go through them in the order that they came in. And it looks like the first one is for Karina. So is mental health counseling covered with admission, even if a student is not using William and Mary health insurance?
Thank you. Yes, everything is covered here. Students pay a health fee, and that would cover the appointments here at the counseling center. There is no cost at all for us. Again, the only situation where there would be a cost is if, based on the type of concern, the student may need more than the bi-weekly appointments that we offer, or if it's an issue that would require long-term services and we would refer out to a community provider. That would be the only time that there would be a cost for the student.
Awesome. Thanks, Karina. All right, next it looks like we have one for Hannah. So you mentioned a little bit about your prevention programs when it comes to alcohol and sexual violence. We have a question in here that asks what y'all are doing or thinking about in terms of education for screen dependence.
Thanks. Yeah, good question. So alcohol and sexual violence prevention are federally mandated. So that's that baseline that we are in compliance with that education. But we did this past year, one of my most exciting things about the year was connecting with our esports teams at William and Mary. And so as a part of that program, we have 5 peer educators who are working on wellness related to, as a part of students' participation in esports. But your point is well taken in thinking about the folks who are not already involved in our esports, but the impact it has on folks' wellness. So I'm grateful for that question, and we'll be exploring more about what we could do for prevention as students join our community.
Awesome. Thanks, Hannah. All right. Another one for Karina, and I think this was answered, but if a student is seeing a counselor ongoing, say every 2 or 3 weeks, would that need to be outside of the counseling center?
The answer is a little complex. The answer generally would be no. If a student can manage their symptoms and they are functioning independently with therapy every 2 to 3 weeks, that's fine. But again, if they would need that type of service for 4 years, we would need to refer. Generally speaking, we see students every other week for about a semester worth of therapy. At times, a student may have, say, 6 sessions, then they feel that they are doing better, come a year later, have another 6 sessions, that's fine. But if someone needs longer term for 2 years, and if that's what they are used to, that they, all through high school, they were in therapy, and they feel that that's what they are going to need, it's much better than, to start actually in the community versus have a relationship with a therapist build a relationship with a therapist for a semester and then having to switch to go to start all over again in the community. So that's why we assess at the beginning, see what the student feels they need. And many times it's based on the type of issue the student is facing. For instance, it's generally speaking, an eating disorder would be, one of the type of diagnosis that we know it's more longer term. And with that being said, depends on the intensity of the issue, the severity of the issue. We do see students with eating disorders, but if someone is just beginning treatment, they have a very severe eating concern, it's much better that they start in the community. That's as an example.
It's very helpful. Thank you. All right, we've got one for Katrina. So you were talking about transferring prescriptions to the on-campus pharmacy. Is that the same process if these prescriptions come from Virginia doctors versus out-of-state doctors?
Yes, that she would contact, if the student brings the information to our pharmacist, they can request the transfer, whether it's out of state or in state.
Excellent. All right. And we have one on here that says, what is the name of the app? And I know that we've had a couple apps mentioned, at least one from Linda and one from Katrina. So could you provide those names again?
The the Healthiest You, HEALTHIESTYOU app is the after hours like medical care. Like I said, there's no copay or fee if you have the student health insurance, and I believe it's $55 for a medical visit if you do not have student health insurance, and that's paid directly to them.
And the William & Mary Wellness app is the app that can connect you to all of the Fitwell classes, registration for any program that's offered through Health and Wellness. And it also contains the contact information for the counseling center and the health center. It's a great condensed way to navigate everything that's available to you from Health and Wellness.
Okay, it looks like the next few are for you, Katrina. So our next one, if a student has private health insurance, can they still access services at the health center?
The answer is absolutely. There is a small copay for to see the doctor, and it's similar to what you would pay if you go to your own doctor. The current rate is $20. I do not know if that might go up a little bit. I don't know, but right now it's currently $20 for the doctor visit, and that's if there are in-house labs, like a rapid strep test or a rapid influenza that we do here, there may be a charge for that as well. Last year, we were really fortunate that the Parents Fund picked up all of those fees, not the doctor's fee, but all of the in-house lab fees. So we're really hoping that that might be the case this year, which really helped the students a lot. But it's a $20 copay for our doctors. And then if they have to send any outside labs, that would be billed to your insurance and pharmacy as well.
And if we are thinking about dental care, does William & Mary have dental care available for emergencies or certain local dentists that a student can see in an emergency?
We have typically had a good relationship with Dr. English, who is a dentist in town. That's who we've used, but there are several good dentists in town. We don't have a specific relationship with anyone. But like I said, there are a few that we worked with, and we have a referral specialist, so she can help somebody find one that would be on their plan if they needed to.
Okay, great. Let's see. So if a student gets a common illness like an upset stomach or they're throwing up, is there any help like an infirmary, or is it just to see a doctor if they want to check in with someone and then just hang out and wait for it to pass?
We have exam rooms and we have triage rooms, but we also have these two beautiful patient recovery rooms. They have 4 beds in them. They have private bathrooms, privacy curtains. We have IV poles in there. So if it's not unusual, especially if there's something going around campus, that if somebody they're dehydrated or they've had nausea, vomiting, if the doctor orders IV fluids, we'll put them in the patient recovery room and usually keep them for several hours just to monitor. We can give them anti-nausea medications, IV fluids. Sometimes they just want to sleep for a little bit, and they often leave feeling a lot better when they go home with a prescription. We stock some snacks here, so they often can go home with saltine crackers and some ginger ale in their backpacks as well. So yes, we do have, if we feel like we need to monitor, we also have had emergencies such as anaphylaxis, in which cases we have all the emergency equipment here. That's another instance in which we would keep the patient and monitor them for several hours after they've gotten epinephrine or any other medications that we've done. So yeah, we have that capability, and that's been great.
Great, thank you, Katrina. I'm not sure who wants to take the next one or who would like to speak to this, but does anyone have any comments on if there are any ongoing COVID restrictions related to your department at this time?
I can touch base on a couple of those because I serve on a couple areas around COVID. I know in the health center, they are still requiring masks. I'm correct with that, Karina, I'm pretty sure. And I think the health center is the counseling center is doing the same. From the student recreation center, we do not require masks, but we are more than happy for people to wear masks if they are more comfortable with that. The university does not have a policy where students have to wear masks at this point. So that part has changed. That changed at pretty much spring break of last year. So I think it's really just like our medical areas where there's not an ability to stay apart, or you're coming in not feeling well and we don't know what's going on. So we are still requiring masks in those areas.
Awesome, thank you, Linda.
I just want to clarify, we can, because the university has changed their policy, we cannot mandate for people to wear masks. I think the only ones who can is the health center, based on the fact that there could be students with COVID coming to be tested, is my understanding. Katrina, you can correct me if I'm saying something wrong about the health center. I forgot to mention that because we were trained and we were offering telemental health during the worst times with COVID, we have that capacity. So if a student for instance, has COVID and feel well enough to have a session, they can request to have that, a session via telehealth, and we can change for that week or 2 weeks to be able to do that. In addition, we have contracted with Mantra Health, which is an agency that provides services to college students, and all they offer is telehealth. Basically, this was a way for us to increase our capacity to see more students at this time. So if any of the parents hear that their student is being seen through telehealth, it could be, again, that they are being seen through our partners with Mantra Health, or we do have a couple of clinicians who, because of their own immune systems, may be working remotely.
Thanks for that clarification. All right. We've talked about this a couple times, but what is the form or method that a student can indicate that William and Mary Health and Wellness can speak with their parent directly? So we've talked about this being a process, but what is the form, or how would a student access that?
So at the counseling center would be again a form that we would provide to the student when we're talking with them. It's a release of information form that they would fill out at the time that they are meeting with us.
Great.
It's not like a blank statement that they would, or a form that they would sign, and for the next 4 years it would be available on file, and at any time then a parent can call. Is on a situational basis, basically.
Great, thanks, Karina.
I did want to address one question that we got in the chat also about the fitness classes that were offered between the RAC and the Wellness Center. Linda always phrases this really well, that the difference is the heart rate. So at the rec center, you're going to find things like cycling, body pump, higher intensity interval training, personal training. We're here at the Wellness Center. A lot of our classes are focused on meditative practices, art therapy, yoga in our beautiful studio spaces. And in the comment, I saw the proximity of the Wellness Center to the dorm. Our campus has so many wonderful little nooks and crannies and paths that your student will be able to explore when they get here. And one resource also that's available if traveling around campus is a problem. They're not directly connected to health and wellness, but they are a partner and have a lot of the same values that we do. But the Bike Alliance has a wonderful bike rental program that helps navigating the distances a little bit easier. And I can drop that information in the chat as well.
Thanks so much, Lindsay. We've got a couple more questions about the pharmacy, Katrina. So the first, we are wondering if you can explain again the process of transferring a prescription to the pharmacy. And then the other would be, could you talk a little bit about payment and insurance and how that works?
Okay. As far as transferring the prescription to the pharmacy, when your student arrives, they can just bring, their bottle of their prescription, bring it to the pharmacist, and they get all their information that they need there to contact the home pharmacy and have it transferred. So that's the best way for that. I saw some questions on there about if you're out of state and your doctor wants to send a prescription. Our pharmacy does participate in e-scribing. So your doctor, if they have the ability to send prescriptions electronically, they should be able to find the William & Mary Student Health Center pharmacy on there. They do accept outside electronic prescriptions, or they can, bring a written one. But if they practice e-scribing, that might be the easiest for your home providers to send the prescriptions through that. And if they have refills on their prescription, that should transfer when they bring their bottle or their packaging with them. And they would bill insurance directly. If your student goes to the William & Mary Student Health Center website and log into the portal, they should have already, if they haven't, but there's a form in there, an insurance form, which asks their insurance information and a copy of their card, and the pharmacist uses that information. They have access to that to bill your insurance for any prescriptions costs. I think there was another one I think those are the answers to the pharmacy questions, I think.
And there was another insurance question, just asking if y'all take secondary insurance, so there's not a copay, or what that might look like.
Yeah, as far as our doctor visits, no, we don't bill insurance at all for doctor's visits, just a flat copay of $20 right now. But there, like I said, if they fill that information out, the lab and the pharmacy have their own billing, they bill it through LabCorp is what we typically send out. If we send out any labs that we can't do here, I will send them to LabCorp, and then LabCorp would bill your insurance. So having that insurance on file is important. I think I saw a question about physical form or for health physicals. I need to give a plug that we do have student health forms that are due on June 1st for all new and transfer students. And those also are on the Student Health Center portal that can be accessed through our website at the Student Health Center. And there's 3 parts to that form. It's a tuberculosis screening form, there's a health history form, and then there's immunizations. So just read through those carefully. If you haven't done them, it's okay. Don't panic. You can still put them in there. And the nurses individually review all of them. I think I have 2,800 in there right now that we're going through. So it's a slower process, but we just verify all the dates. And your student, if they've already submitted it, they'll hear from us. They'll get a secure message through their William & Mary email if we need anything, if there's anything missing, and they can respond to us through the secure message as well.
Great. And we've actually had a couple more come in for you. So while you're here, what about allergy serums for allergy injections? Is it bringing the serum to y'all at move-in?
You can. Sometimes their allergists prefer to mail it to us. There are some allergy forms on our website that we need you to print off and take to your allergist and have them complete it and bring those with your serum along with your injection records. And we deal with pharmacists from all over allergists from all over the country. So we're used to all different types of orders, and which is why those forms are so important. It just allows the orders to somewhat look similar. So your doctor can complete those for us. And then they would just bring those forms when they do come to move in. And like I said, they can either bring it and we have a refrigerator that we keep them in, or your allergist can mail them to us.
Great. Thanks so much.
Can I jump to say, for, I think one parent was asking about the student being seen every 3 weeks. One thing that I want to recommend is exploring, especially if you do live in Virginia, and if the provider has a Virginia, or if the provider has a Virginia license, many times our students may prefer to continue with that therapist if they are offering telehealth. So just be aware that that's an option that many providers are offering, either, again, a therapist or a psychiatrist. And that would be a good way for them not to have to restart with someone new.
Great, thank you, Karina. Since we have about 5 minutes left, I want to go ahead, Lindsay, and just invite you again to share the email address. The best way, if we didn't get to a specific family member's question, what is the best way to get that question to y'all?
Yeah, you can reach out to us at wellness@wm.edu. All questions are welcome. We'll make sure that it is connected with the person who is best equipped to give you the correct answer. That's wellness@wm.edu. Earlier in the webinar, I shared a link to the Parent and Family Launchpad that's intended to kind of capture all of the information, bits and pieces, and also links are active on that. So as you see things that are interesting to you, that will guide you to the associated websites. I'll drop that email in there, and feel free to explore our website and reach out with your questions.
Excellent. Thank you so much, Lindsay. And that's such a helpful document just to have everything compiled there. I want to say a big thank you to our presenters and for family members who are here. You will see a lot of these familiar faces if you come for family orientation. So you might get to say hello in person, which would be wonderful. So again, I want to thank all of the panelists for providing information, answering questions, and then everyone who attended. Thanks so much for your presence. And this webinar is recorded and we will post it online early next week. So again, if you have any questions, send them to wellness@wm.edu. And we look forward to seeing you on campus in the fall. Hope you all have a good evening.
Thanks, everyone.
Thank you.
Thank you.
Thanks.